You've likely heard the saying, where there's livestock, there's dead stock. Losses are a challenge for all producers, but understanding why they occur is the first step on the road to prevention, especially when an animal dies unexpectedly or from an unknown reason. One of the best ways to do this is by having a post-mortem performed by a trained professional. You have three options when a goat dies or needs to be euthanized. Your veterinarian can do the post-mortem on farm or at their clinic. They may even send samples to a lab for further testing depending on the case. Or your veterinarian might tell you to bring the animal directly to the animal health lab for a post-mortem there. Your final option is to do nothing, and the losses may continue. What's the value of a post-mortem? Well, it's about understanding the cause of death so further losses in your herd can be prevented. Your veterinarian is an expert on animal diseases and is well positioned to make a diagnosis by performing a post-mortem. Sometimes the cause is obvious. Other times, more testing is needed. The University of Guelph's Animal Health Lab, or AHL for short, employs veterinary pathologists and microbiologists who can perform specialized tests to better determine the cause of death. Is it a bacterial infection? Spoiled feed? Is it parasites? What caused this goat to waste away? Fortunately, the government subsidizes the AHL to support farmers and make testing affordable. You and your veterinarian can use the findings to develop a plan to prevent future illness and death on your farm. So, what should you do when an unexpected or unexplained loss occurs? Start by calling your veterinarian. Keep the carcass cool, but never frozen, and store it away from other animals. That includes the farm dog and cats. Post-mortems should also be done on recently dead animals. Less than 24 hours is best. These are the keys to getting the best results possible. Remember, a post-mortem isn't just opening up the animal to look inside. It requires a good history of that animal and the herd. A thorough history includes a description of the ration, clinical signs of disease, when the problem started, and any treatments and vaccinations used in your herd. Be prepared to provide this information to your veterinarian. If the post-mortem is to be done on the farm, choose a place away from your livestock and somewhere you can easily clean. Your veterinarian will have the proper tools, but you'll also need to safely dispose of the carcass afterwards. It's worth staying with your veterinarian to ask questions. They'll be pleased to show you what they find, and it's a great way to learn. After completing the post-mortem, your veterinarian may have some ideas about the cause of death and make recommendations to prevent further issues. This may involve setting up a vaccination program or designing disease prevention protocols. Let's consider a few cases. Enterotoxemia is a common cause of severe illness and death in adult dairy goats. The intestine is red and inflamed, causing severe diarrhea leading to dehydration. The disease is caused by a toxin-producing bacteria called Clostridium perfringens D, which are ingested by the goat as spores present in feed contaminated by manure or soil. It is important to review your Clostridial vaccination program and revaccinate if necessary. And also look at the herd's feeding management, as high-energy diets can worsen the severity of the disease. Haemonchus contortus, also known as the barber pole worm, can cause severe anemia and bottle jaw, with animals sometimes dying suddenly on pasture. Your veterinarian should review your parasite control program, including testing for resistance to the dewormer you are using. A goat showing abnormal behavior presents a special challenge. Listeriosis, also called circling disease, is caused by feeding poor quality silage. Sometimes it isn't the silage, but spoiled hay or bedding. Other neurological diseases that can be a cause of abnormal behavior include polio, brain abscesses, and rabies. All of these conditions require that brain tissue be sent to AHL for specialized testing. Sometimes an animal loses body condition and must be euthanized. There are several chronic infections that may cause this. For example, Johne's disease is common in goats in Canada, causing severe wasting of adults as young as 2 years of age. This diagnosis means that there are many more infected animals in the herd. Healthy-looking animals can also spread the disease in their manure, and kids can get it from a contaminated environment, during pregnancy, or from drinking the milk of an infected doe. there are no drugs or vaccines available to treat or prevent new infections. Getting a diagnosis will allow you and your veterinarian to develop a plan to eliminate infected animals and reduce the risk of spreading the infection to replacement stock. So, how much is that dead goat worth? You may think it is worth nothing. After all, it is dead. But the information it may provide could make it the most valuable animal in your herd.